Hey,
Okay,
hello
okay.
everyone. Welcome to Blumberr Podcast, where we bring you the journeys, innovations, and real world contributions of doctors shaping the future of healthcare. Today's guest is someone who brings together surgery, precision, and entrepreneurship. That's Dr. Deep Dutta, an oral and maxillofacial surgeon and implantationologist with over 18 years of experience. He is not just a clinician, but also an academician and healthcare leader driving impact in regions like Tripura. Hello, doctor. Welcome on board. How are you doing?
Thank you, Pushpa, for this those kind words, and I'm really happy to have been given a chance to talk to you. It's great to be on your show,
Pleasure is mine.
and it's a great platform, and I would love to be yeah, I'm just loving it.
Yeah. Thank you so much for your kind words, doctor. So let's start. So you grew up in Tripura, right? And
Yes, yes.
how was your childhood in Tripura? Tell us a little about Tripura.
Yeah, Tripura, as you know, is in northeastern India, and it's a landlocked state.
Okay.
So it's a beautiful state in itself, and as such, Northeast itself is very beautiful
Yes.
and very serene as such. My childhood, as I was born in 80s, 82 to be precise. So those are the days when we didn't have much of TV and mobiles and stuff. So I grew up in the playing, and I belong to a family where sports and medical field both comes together. Like my mother was the OT sister in the government hospital,
Okay.
and my dad he was in sports. He was in swimming, in fact. So he got the first gold medal for the state in national school meet
Nice.
from Chennai.
Oh, from
Yeah.
Chennai. Okay.
Yeah, Chennai. So that's how it was. It was like sports, and always there was a tussle between sports and studies, as you would understand. So that's how I like. But I grew up. It was really nice those days. When I see today the children and everyone, they are stuck to the
Mobile.
screens all the time. Yeah, I really miss whenever I cross my school. I miss that there are not many children in the playground. So, but then in our days, we used to literally like take out time so that we can rush to the field,
Yeah.
wait for 4 o'clock to hit, or stay back
That's-
in the school.
Yeah.
Even if after finishing the school, you'll stay back, and the parents will be like, "Why are you late?" Like that. So
Yeah.
so that's how, and it was really great growing up here. And although it is not something like a big city, but then it has its own charms, to be very honest. And the people here in Northeast, as you all know, were very welcoming, very kind, and we grew up in a state where we have mixed culture. So the indigenous culture, the Bengali culture, everyone are together. The food habits, everything is.
Nice.
So it was great to be here.
Great. Actually, I must tell, I have always been interested in Northeast, and that's
Okay.
the reason why I asked so much details about Tripura.
Yes. In fact, you should. If you have not visited, you should make it a point. In fact, what I would say, I have been to a lot of states in India, and it was my I would say it was my bad luck that I couldn't. First, I didn't visit the neighboring states of mine. Now, which I'm doing now,
Okay.
going to Nagaland and Arunachal, and as I'm growing, I am more of a person who likes the seas. But now I developed a connection to this mountains and hills, and the people are so sweet here.
Right.
They're so good. And there's a misconception going on, these are you go to northeastern states, maybe the accessibility is not so good and all. I would take a chance through your platform to tell you can visit Northeast, and it's really great to be here.
Okay.
It's an awesome feel, and you can feel very close to the nature. No, and away from those busy city honkings and all the pollution, and it's very serene.
Yeah, I definitely want to visit once to Tripura. I actually, is that the reason why you stayed back in Tripura? Most people who have studied so much as you have done would want to relocate, search for better opportunities outside, but you stuck to your home city or home state,
Yeah.
and your continuing providing services to your local people there. So, was that one of the reasons?
Yeah, you can say that. But then, as growing up, when I went for my BDS,
Okay.
I joined Chennai,
Hmm.
and it's like second home to me. Chennai, really, like even recently when I would, my children would tell that I would watch the Tamil Nadu news and everything, the election, everything is going, and Talapati has won. So it was really a festivous thing in the house.
Okay.
Like, and I was very engrossed by that because I grew up watching Vijay's movies when I was in Chennai.
Okay.
So yeah, when I went to Chennai, there was a thing that, I want to be in the big city and stuff. So then what I would say, the healthcare, the teachers whom I got there, the ones, they motivated me the way they passed the education and knowledge to me. There was always a thing when I realized that, I should eventually go back rather than staying here. Because whatever I have learned, okay, my professor used to tell, when you have knowledge, you just let it flow. You don't keep it inside you. Whatever you get from us, make sure that it reaches. And I thought it would be a great way. The guide who has guided me through all these years, if I can carry his this message to this part where healthcare as such was still now we are trying, because I think you would know the chief minister of our state is a maxillofacial surgeon. So he is a maxillofacial surgeon, senior surgeon he is. So after sir came into the picture, a lot has happened here.
Okay.
Even we have opened, like there is a government dental college which has opened, and a lot is happening. But before that, when I came back in 2010 and 11, the facilities were not so at par, I would say. Government hospitals were there. Okay. Private clinics were there. But the treatment setup which I saw there in Chennai or Bangalore when I got trained, even the facilities which they were giving, the cashless facilities and everything. And maxillofacial as such, it was great. It was great seeing the infrastructure they have built. How patients with ease would go, get treated. So then I got little moved that I want to get this to my state. I want this culture should go. Yes. So there should be a start. There should be a thing where people should know that this is the level of healthcare which can be provided. So that actually drove me. So even I was like, what I would say, my batchmates, we used to discuss. At that point, the biggest thing would be going to Middle East, being a maxillofacial, going off to Middle East, and there are a lot of opportunities there. And then you have great work being done by Dr. Moni Abraham Kuriakose was there in Narayan Hridayalaya. He was with Dr. Devi Shetty. So head and neck oncology was at boom. And I was very lucky to be with him for the oncology training.
Okay.
So So I was in Narayan Hridayalaya.
Sorry, doctor. Sorry to interrupt here.
Yeah.
How is PDS and oncology related?
Yeah, so what happens is after my BDS, I did my super specialty in maxillofacial surgery. So maxillofacial surgery is related to all the facial surgeries. So oral cancers, they are treated by the maxillofacial surgeons.
Oh.
So that also,
Okay.
So that also, you can say ENT and maxillofacials now work in team.
Okay.
So there are fellowship programs where they are connected.
Okay.
And that's how you get maxillofacial surgeons in oncology.
Understood.
So Dr. Kuriakose was such a visionary, and that is the first time, because I finished my BDS and I had gone to MDS, doing MDS there.
Okay.
And that is the first time when I walked into that Majumdar Shaw Cancer Institute. The first time I remember it was a 12-hour surgery. The first time I had seen a maxillofacial surgeon operating for 12 hours. And we were there in the operation theater, and he was dedicatedly doing. And he didn't have the thing like, the time just it started around 8 in the morning, and it was already like passing 8, and we were standing so much. And didn't realize we went inside with the sun coming and came out with it was all night. And so that's how, the small things, they keep coming to you, and these actually provide that fuel that, you want to go back, you want to do this there.
Yeah.
So that really pushed me that I come back here.
Okay.
And when I came, as I told you, there are a lot of opportunities. My batchmates started telling, why you want to go back? You do this,
Yeah.
you do a fellowship. Because that is the time when what my teacher used to tell, when you finish MDS, you are like a popcorn. So you are just pumping out the plate. You are all like, you want to do surgeries and you want to do something, you want to come up in this life. So we were like that. And once I came, I remember it was around 2011, 12 in October or something, I came back. I would be very honest with you. There was a thing inside me. I was divided. Where should I do? And in fact, there were opportunities which are coming up there. But then once I came here, once you reach here, then again, these things come to me, that ease of treatment when I went to the hospitals. And here, at that point of time, there was only one private hospital here. And apart from that, there were like a couple of government hospitals which were handling the all the trauma cares and everything.
Okay.
So then I felt, right, let's. This is more challenging than what I'm going to.
Oh.
Maybe yes, I come here. My educational. What happens is when you come to a corner state like Tripura, you are disconnected with all the educational. How do I tell? The new techniques which are coming.
Yes.
All these things you don't get to. You have to sacrifice on that.
True.
So, but then I was like, okay, let's start with basics.
Yeah.
Let's go there. And that's how I stayed back and I joined ILS Hospital, the private hospital, as a consultant. So that was it. Like, and my parents, who thought that I would not come back, it was a shock for them also.
Okay.
They were really surprised.
Oh, nice.
And once parents, I won't say at that point of time I understood that what they used to think, but now I realize that they had an idea like, my child has gone to a bigger place.
Okay.
So there will be very less chances that he comes
back.
because he is now educated that way. So they were really happy that I'm here, but then they were also thinking that you have done this and you are coming here. What would happen? What you would get? Because if I remember, there were 6-7 maxillofacial surgeons at that point of time, and they are very senior. 4 of them are very senior, and 3 of us were like the new ones which have come. So before me, I was the 7th or 8th, like that. Before me, 2 of them come. They both went to the government setups.
Okay.
And then I would say at that point of time, I would not say that I was lucky enough. But now, if you ask me, I thought I was very lucky enough to join the tertiary center like ILS, where the cases come like that, which are like maybe at that point of time cannot be dealt in a government hospital because of the traffic and everything.
Yep.
So I was very lucky that way.
Nice.
So this is how it all worked out,
And I can see that you are also very happy in the space that you are, because you are with your parents,
Yes.
your family is rooted, and also you're still serving
Exactly.
the state. That's
So what I feel that as a son, what I feel, our parents, they give everything. Like, coming from this, if you see, it's not about our place, everywhere.
Yep.
They give everything. So at this particular juncture of their life, I really treat them like children now.
Oh, nice.
And like, they are children. Now I am supposed to take care of them, because how they used to do it.
Yeah.
How my dad used to do it.
Yeah.
Because at the very beginning, I was not much into medical field. I was trying to think about sports or not. I was very much interested towards Indian Air Force exams and flying the flights. And, you have the craze at that point of time. So, but being the only son, so they were not at all interested in all this. And, at that point of time, you have this. either you become engineer or a doctor.
Doctor, yeah.
You don't have any other mid paths or something.
You're right.
So yeah, I'm very much indebted to them. They took a decision for me that you should go, and even at times others they ask why not MBBS, and I was like I was not even thinking medical. My parents they told okay fine why not BDS, you don't need to, because at the initial years you have this fear of blood and everything. So you don't immediately. I now see that now the children have very big clarity. They even at a young age they know they want to become.
Yep.
But our time it was still confusing. We are really confused what to do.
Yeah, very.
So but that's really so. That's how. Yeah, I'm very much in a great space with them because I get to see them. I get to talk with them. Maybe have times if I miss the lunch, also have dinner with them. So that's how it's a very good space I'm in.
Great. It's so beautiful, your journey with your studies. So, did at any point did you feel that you're missing out on the additional technical technology study that you might have, or you're covering up with the online courses if any available? How are you handling that?
Yeah, technology really helped. To be very honest, with technology, all this advance coming, all the connectivity which has come, online classes. So they played a major role. To be very honest, to keep myself updated with what is happening. Because end of the day, medical field, I feel medical field updates every 7 days. There's a new one now, something coming.
Yes.
You cannot just stick back to something and think this is the ultimate. Because in medical field, nothing. Even when I do say a simple wisdom tooth surgery, when I do that itself has got so many varieties. So every time you start, it's a clean slate for you.
Yeah.
You cannot say that it's a very simple. I have done it 1,000 times and I'm going to do it very. You cannot say it because medical science, every time it will surprise you. And that is also another passion which drives me. You need every day. They tell that if you don't find that passion, that challenge in your work, so it is no more, like serving you as such. So yeah, it is very much. And every day with the new advents and beautiful things being done all around the world, even in our country.
Yeah.
And it's really great. So internet really played a big role.
Okay.
And it helped. And keeping updated. My friends are there in Chennai, Bangalore. We have these talks and stuff. We are blessed with, I'm really blessed with those batches of mine who are they keep a constant touch with me. And it really helps. And because I was in Chennai, there was this, I had to learn Tamil. So I had to learn Tamil, and so I get to speak in Tamil with them.
Okay.
So that stays in practice for me, and it's great connecting. Somehow the way we are connected, we are connected network, WhatsApp group, something coming up.
Right.
Say someone comes with an idea that this article we want to put, and would you put input? Because I am here. The biggest advantage is the volume is here.
Yeah, okay.
You get a lot of volume if you have a target that this kind of cases you want to write an article in. So you have the volume here, so you can identify them, and I can be of help to them. So that way it is a big help. Yes.
Nice. So, doctor, I'm going a little behind now, back in your journey. So,
please tell me.
At what stage of your life did you decide that you want to become a medical or a healthcare? I know you told that you did not per se think about anything, but your parents were.
Yes, in my higher secondaries, after I would be very honest with you, I was really inclined. And I will tell you this story. I had joined BDS at that point of time, and there was our vice principal was there, Sugmaran sir. He's a very great gentleman, and he was taking an orientation class. So I was maybe at the corner of my heart, I was sulking. Oh, come on, I wanted to be an Air Force pilot and all these things, these thrills. So he was asking everyone a very simple question: what you wanted to become and why are you here? And everyone is getting up and telling. So I realized, okay, fine. It's not only me. There are a lot of people who are there who are different. They wanted to be in different place. So then someone told photographer, someone told they wanted to go for MBBS and all that. So then I got up and he asked me tell me, young man, what you wanted to become. So I told him I wanted to become an Air Force pilot. So he was like, really? I said, yes. So then I can provide you with something which, like, you can match the Air Force. And I was like, I was really confused. I didn't know what to tell. And I was, okay, sir. So we use this hand piece, like the drill,
Okay.
which we use for preparing the cavities and stuff. So he told me that. And so this particular turbine moves at the same speed of how a jet engine runs.
Okay.
So so you're going to deal with the same speed, but then it should be in the tip of your fingers. So it was like, okay. And we're like, okay, maybe we're not wearing the uniform. We as a practitioners have different uniform. But then here comes, that he just inculcated that small thrill that, see, you're going to deal with that only. So I would again say I was blessed with such good teachers. They would bring out the best in us in every possible manner. And from nowhere, actually, like, they will be like pushing us that way.
Yeah.
Even learning Tamil, as I said, I learned Tamil.
Yeah.
Dr. Rajkumar was there. And he used to take oral pathology for us. And trust me, like even now, we remember those days. We were supposed to go to the class by 8:00. Sharp 8:00 we should go. So otherwise, if you are 8:02 or 8:03, you're going to stand outside the class. And no one wants to miss that class because he takes beautiful class. And he's a very strict teacher. So on the very first day, me and my buddy, like, we used to stay at the hostel. So we got up and said, okay, fine, by 8 we'll be there. So we went there at 8:00 and no one was there. Like we were standing in front of the lecture hall. The lecture was locked. And we were standing there and we were joking, like, see, no one came today. We two only, everyone will be standing outside.
Okay.
And then suddenly we realized there is mild buzz, which is like, so there was a window, and it was slider window. We just opened it and said the whole class is actually sitting inside.
Okay.
They have gone through the window inside. The door is locked.
Oh my God.
And we two are standing outside. Then we done that, sir is standing behind us.
Okay.
And we, sir, they have gone inside. We are like, and he looked at the watch. He said, okay, fine. You guys are on time only. So we entered the class. And the first thing he told after standing up, like, you guys have come from North India. How many of you are from, the other states, not from Tamil Nadu, not localites? So we got up and like, I would tell you one thing, learn Tamil.
Okay.
And we were like, okay. Well, like, the only word which I had learned by then was for water, tanni.
Tanni.
And konjam, like,
Little.
they will tell konjam teriyo. When say we're going for an auto, we say that.
Okay.
And then at that point, I thought, okay, fine, why we need to learn Tamil? But then when we went to the clinical side in third year, if you really want to connect with your patient, if you don't talk in their language, it's such a barrier.
Correct.
He did it in the very, very early year itself. He told us that what you want to face.
Yeah.
So those things, I would say, were like, the small things. So once I was in, and after that, there was no looking back. I really wanted to be there, and I wanted to be part of it, and everything was to go. And there was no looking back once I was inside the BDS curriculum, and because of the teachers, because of my friends, it was really great.
Nice.
So here comes a boy who doesn't want to be a doctor, and now I'm in my place.
Right.
So it was really, really great.
Nice. So that's an interesting story, Doctor, about how your BDS journey started. So
Yes.
So oral and maxillofacial surgery, it's a very demanding, or I would say very complex field, right?
Yes.
What drew you towards it?
Very much. Like the word, the field also is very complex, I would say.
Okay.
Because when in my state, I used to come and tell maxillofacial, they will look at me, they were like, what is the branch? Like I said, it's maxillofacial surgery. And how being a BDS, you are in a hospital. It was like, what happens is, as I told, we were just fresh out of the college. We really wanted to do big surgeries and stuff. And here the people are looking at me and like, this guy is very young.
Uh-huh.
What he's going to do? And as coming to the word, and they didn't understand what exactly maxillofacial surgery. Even now, we are, I would say, all over India, a lot of things have been done by our central organization, AOMSI. So a lot of awareness has been created. But still, at a certain pockets, maxillofacial surgeons, what exactly they deal with and what exactly they do, it's kind of a mystery.
Okay.
Because first of all, the question being a dentist, how you end up in a hospital.
Yes.
And I will tell you, if you ask a maxillofacial surgeon, he will tell that is the sole reason that he has gone for maxillofacial surgery. Because after you go there, you want to be in a hospital, you want to deal with such cases. So that becomes the first motivation. So for me also, it became the first motivation that I want to be a surgeon.
Nice.
Because so once again, you will find this reference a lot of times. I had this great teachers in my oral surgery department. And here I will tell you a small story. Like, we have these postings. So 1 month postings. And we are supposed to extract a tooth. That's how we start. And you have to inject. So now, my whole life, I never injected anyone.
Okay.
So I am somehow the other sliding. I don't want to go for giving injection and pulling out the tooth.
Okay.
I'm really I'm concerned. I'm not able to go there. Every day, if say my number comes, I slide somewhere else. Go over here, there.
Yeah.
So there was my friend, and he was just finishing his posting. So he came and told, how many did you remove?
Okay.
And I was like, no, none. He told, why? No, man, it is very difficult. You give someone tricking someone, It is really a problem.
Yeah.
That if you want to prick someone that way.
Yeah.
So then he told, come on, if you don't remove, say you become a dentist and you don't know to remove a tooth, people will laugh at you. So then I was like, okay, fine. Then I told, no, first I'll remove a mobile tooth, which is moving, not much effort. Then he said, what are you joking? You come and take a strong tooth out.
Okay.
I was like, first step, I used to, first step I didn't give. You're telling me to run. So, yeah, it's okay. Come, let's see. So, and then my teachers are there, they guided us, I would say, Dr. Sainath, Dr. K.K. Raja, they were they are gem of persons. They came, they took out the fear from us.
Okay.
It's not easy. Why I tell you, it's very difficult. Nowadays, maybe people see that, effortlessly he's putting injections, blocks here, they're numbing that thing.
Yeah.
But the very first time when you prick someone, it's really...
I agree.
The reaction of the person, it's a different kind of feel.
Yeah.
And then you pluck out the tooth out of the mouth. It was like a different thing. But then once you do it, I feel you get that, how do I put it? You want to do it more. Right. The addiction comes.
Right.
Because the challenge comes that, we used to, then after this, we two friends used to compete. You want to take this tooth? I will do. Like this, like this you started.
Yeah.
And that's how oral surgery it came into me that, I became so much addicted to it that even in my, say, break times, I would go there and be there in the department.
Okay.
And maybe some of the friends who need help, be there with them, see that. Okay. So I grew that process, yeah. I would... And then came the fact that, I used to see they're wearing scrubs and going to the OT. They are talking about this. I've done this case. This cyst has been taken. This fellow, this one fractures. We took it out. So those stories were like, okay, fine. One day I want to become, maxillofacial surgeon. Yeah, that's how it happened. So yes, once BDS was over, and I was like, okay, fine. If you want to, there are 7-8 branches which we had. So the only thing which we thought was we want to have maxillofacial surgery as a branch. So that's how I ended up in maxillofacial surgery.
Wow.
And with that also, I will attribute this to one of my seniors. He was there all the time with me, Dr. Prem Alex Lawrence. And he was the one, I remember one instance when I first joined the hostel, and he had given me a Thirukural book.
Tirupural.
So Thirukural, it is like verses. He's a famous poet
Oh,
who was written 2-3 poems
Verses.
sort of,
Okay.
and that carried verses that carried a message
okay.
for everyone.
Acha.
So he told me that you learn this.
Okay.
And I said, sir, I don't know to read this. So he told, okay, fine. I will tell you. You write in English, you learn, and tomorrow come to college and tell me.
Okay.
So night I would sit and I'll read and I'll mug utter something. It was just true. And he will tell me the meaning also. That what is the meaning of this, what the verse. So next day I would go to college and he'll be sitting. Then like we there are a few localites who are going. I'm also going. Now he would call, come here. So he first he will not ask me. I said, do you know Thirukural? And he will like, no sir. Then he told me, you know Thirukural? I said, yes sir. Tell me one. So I would tell the same thing which he told tonight. Then he's telling, look at him, he has come from Tripura. He knows. You guys, he was having fun at our expense. In this process, he taught me a lot of stuff.
Okay.
And a lot of verses which meant a lot of things in life. So he was there in the college where I went. So he was there already. He was in periodontics. And I called him up, sir, I want to join. He said, yeah, please come, do come. You're going to be my junior here also. And it was fun.
Yeah.
It was fun. And we had this, I used to stay around like 15 kilometers because I was in a different college when I did my BDS.
Okay.
And SRM. And the other college when I joined is Balaji. It is some 15 kilometers apart.
Okay.
So then, so he, one day he met me in the canteen. He told he shifted here. I said, no, I'm not going to shift. So he was like, you're not going to shift. You're going to stay there. I said, yeah. So he told, okay, fine, buddy. I am betting $5,000 on you that, after 6 months you'll come here. And I stayed back. After I finished my MDS, I went to him and said, sir, I have stayed back. I have not come here.
Okay.
So you're going to give me a treat. So he was like, this kind of fun banters were there. And that's how like, life was like college life. Even if you tell me, if someone gives me a time machine and I would like jump on it and go back to my college life again,
Nice.
live those days. Maybe somewhere I lived little lesser. I should have lived more. Now when we talk to friends, it's like that we should have done more fun.
Yeah.
And all
College
that.
life is always.
Surgery was always, yes, it was always fun. And I enjoyed being a surgeon. That's how I ended up being a surgeon, actually.
Great. Doctor, you have been in Chennai and also in Bangalore, where you have seen, as per your words, beautiful, like really good technology and everything incorporated. And you tried to repeat that in Tripura. Like, what kind of gaps and challenges did you come across while trying to set up things in Tripura?
Okay. The thing I would say for Chennai and Bangalore, they're very systemic.
Okay.
Everything is in a system. Everything is set. There is no there is no deviation.
Okay.
Everyone in the team, they know what their job is and they will do it to the team. They will do it. You don't need to worry about it.
Okay.
So what the first thing I came here and found, the first thing was being a maxillofacial surgeon. Because people were not seeing this kind of surgeries here. They were not, first of all, understanding. The very first thing which I would say, when there is a EMO, emergency medical officer, they didn't knew which case to go to maxillofacial and which case to go to ENT.
Oh.
Because ENTs were doing those cases because maxillofacials were not there. So that is the first challenge I would say I faced here. Because creating that awareness, this case is supposed to go to maxillofacial surgeon, this case is supposed to go to ENT surgeon, So that is the first thing. Secondly, being here, the equipments, the gear which we use there, the diagnostic aids that we use there were not here. So we had to go back, we have to reverse at a certain part.
Okay.
Because in our curriculum, that is the best thing. And this also I would like to mention, when I joined my MDS, the first 6 months, they used to let us treat those difficult wisdom tooth removals
Oh.
in a different way, in a style which was not required, but then it really like the basics, the very basics were taught.
So, without
Say use.
using the infrastructure or tools, you were trying to do
Yes, yes, they were telling,
extraction. Hmm.
and not even the handpieces. The superior handpieces were not given to us. We would use a chisel and a mallet, which is that point of time outdated,
Yeah.
and will slowly curve and take the tooth out.
Oh my God.
Trust
Okay.
me, trust me. Every PG would be telling you that those 6 months. It is like an officially you are being like put there and you are put into a place and you are like, okay, go through this because you are not allowed in the PG section until unless you finish those 6 months. But then when I came here, that really helped. So that really helped because we didn't had that kind of a gear, and slowly it came that we need this, and when it came, but it really helped. The limited resources which we were given to at that point of time
You made
helped here because we already had. Yes, we had this limited resources over here, and then came the point where and the exposure which matters. I would say Chennai, Bangalore, you have exposure to a different area of cases. Very different cases because I from if you take from Eastern India, people go to Chennai for treatment. North India, they go to Chennai.
Yep.
And you get a lot of exposure. And so when I came first to the hospital, the first case I had was a road traffic accident where the person had broken his two TM joints simultaneously.
Okay.
And we used to do single ones. And we because those double kind of cases would go to a private hospital, not come to a college rather.
Okay.
So I did say right, left like this, not right, left, both together.
Okay.
So that was my first case in my new hospital, and there was this, and my anesthetist, Dr. Raghavendra Prasad, he was like a very sweet person, and he would tell, say, Deep, this. Just don't, you was fresh out of this thing. So you are sure about it. And I was sitting in the system, I was looking at the incisions, everything. What are you doing? I said, sir, I did one side and this side also, but not both sides together. So he's like, you'll kar lega na? I said, yes, sir, I'll do it. So that confidence, the team, then we built a good trauma team. So once we built a trauma team, the orthopedic surgeons pitched up, the ENT surgeons came, the neurosurgeons came. It was a great team which formed, and I was really I was thanking my stars that I come to a hospital, and I am part of a trauma team. And when a trauma comes, immediately all of us are called. So it was a different thing. And this, when I first saw it, that was the first glimmer of system in front of me, which I had seen in Chennai and Bangalore. I still remember there was Yashashwini, I guess, if I am not wrong. It was Yashashwini, some healthcare something it was, and they used to give at that point I'm talking about 2009-10. They used to give cashless facilities. So which was literally a dream here to do. Right now we are doing cleft surgeries for free. We are doing under this one PMJ. We are doing trauma cares for free. But those were I have seen in 2009-10 in Bangalore.
Yeah.
Which I am coming and seeing it now here. So it in a way, at times I joke with my buddies, batches. I tell, you guys couldn't go back in time. I went back in time. So I had went back in time, and I got all the things which I saw first there. So I'm seeing the beginning of all that. But it really helped the system and the way things are put. Even recently, not recent, I would say, 5 years back, I had gone to Bangalore to be with Dr. Preetam Shetty for a cleft upgrade. So there it was so beautifully they are treating the cleft patients Like, if I take the cleft patients are like the ones who have the cut lip, they don't get it joined,
Yes.
and the palate also.
Correct.
Yeah, yes. So what at a point we used to do is just close this, close that, and but then this particular patient, at what age that patient is operated, their speech gets
Oh.
difficult. Yeah, so it is a psychological thing. So before 1 year, before the person starts speaking, finish this, all this at those minute levels. There's a behavioral therapy doctor who is seeing the child so that they don't go into depression, because all this there's a social stigma which goes on.
Yes. Yes.
The part what I want to tell is they have gone to such depths in Bangalore and Chennai. They've discussed, there's orthodontist, even even before the child starts getting ready for a surgery, they would do preparative procedures so that the looks are not hampered after the surgery. And everything is so detailed. So when I went there and I saw it with Dr. Shetty, I was really lucky to be with him. And it was like, I saw that and I was like, I really want to take all this. I was taking notes and everything. What are you doing? I said, Sir, I want this same thing to be
Tripura.
Copied there, because I need it. Maybe I don't have a speech therapist at my disposal right now. But couple of years, if I keep pitching it, maybe someone will join the band. And now we have a team where we have orthodontists, we have the cleft surgeons, then we have a speech therapist, behavioral therapist. So they're doing a great job. They're doing a great job, and I'm really happy to be. And the biggest thing is that everything is free. The patient doesn't need to pay anything. Yes. So it is part of the government has also pitched in RBSK, Rashtriya Bal Seva. That plan is coming pitched in. They are identifying the patients. Then I had this beautiful tie-up with BSF because Border Security Force was in the border areas. They will identify the patients. Okay. They'll bring the patients to us and we'll operate. Then I have got Dr. Shetty got me in loop with the Smile Train project. So some patients were done through that. So and the biggest thing is that the patients, it is a life-changing kind of a surgery which is happening for a child, very young child.
Yep.
And it's really great, and it's done for free.
Yeah.
And it just gives you a great feel after you've done the surgery, and it gives you a great feel. So yeah, all these things, the process, the system, I have learned, and I came here and I saw all this that was lacking. But now, as I said, it's catching up very fast, very fast.
You are part of the incorporation of these systems in Tripura.
Somewhat, whatever I could, but then I now would say with all my immediate juniors coming, there are a lot of doctors who have come, very nice hands and very energetic. So, and when you get such kind of fresh blood, you yourself feel that energy that let's do more. So it's really great to be having them also with us.
Nice. Okay, as you were saying, when you are doing such kind of high stake surgeries, right? The cleft, the trauma surgeries and everything. I mean, that itself is a trauma, the cleft surgery, and other complex surgeries like oncology, facial oncology and stuff. What goes through your mind, doctor?
This I would want to tell you in a very different way. Like, at the very beginning when I started this, doing these surgeries, it was more like I wanted to succeed.
Okay.
However, it should succeed. But at a later stage, what I realized that, you develop empathy towards the patient. You have to have a empathy, because say, I'll tell you trauma, which is much easy. A person was going home, fell down, broke.
Yep.
And the family is in chaos.
Okay. I had that.
Right.
I fell down and I broke my front teeth.
Okay. So if you break your front teeth, say the jaw is broken.
Okay.
First of all, the person is in a state of trauma. There is a chaos in his mind. He doesn't know what has happened. The family is in chaos. So then you come there and you are thinking about your success. No, the first thing which I feel is the challenge is to bring down the chaos to a stability. So there should be a lot of empathy which has to be there. You should be patient enough to listen, because I see certain times, I see these things where the patient becomes violent, the doctor becomes violent. I understand the doctor is having his own thoughts, the flow of thoughts is going because he has a patient, he has to keep the patient stable.
Sure.
You have to understand the family also. They are in a state of shock. So I never take the behavior as something which is trying. No, he's not trying to offend me. Actually, he's not able to vent the emotion.
Frustration.
Maybe that's how. Yeah, the frustration. What is happening? So what I feel, the first thing what I do whenever I go for a trauma call, like we go for 24/7 on calls we have. So the first thing is to communicate with the family because I have to get them on board. See, this has happened and this is the clarity I'm giving you. We will try to settle it up.
Okay.
So that is my first thing mindset comes when you inform the family people.
Sure.
So the second thing is that, that's when you plan a surgery, when to do. The thing with the facial fractures is most of the times you get a lot of swelling.
Okay.
So, and you are dealing with the face.
Yep.
So the first thing, as we all say, smile, face, it makes the first impression when, someone, even before I feel even before someone talks, a smile.
Yeah.
It's kind of, it has got no language. Anywhere you go in the world, you smile.
Yeah.
You don't see other person grumpy. They will be like, they will smile back. They're bound to smile back. It's kind of infectious.
Yeah.
So when you deal with the face, we have to be that careful that, this person, say they had such a beautiful face. Now say you have fractures, you have to get it aligned like that.
Yeah.
So then comes the second challenge where we have to gather that history, what the alignment should be proper. And then after that, what is like, when we once you go into the surgeries, yes, the training comes, then your muscle memories come.
Yeah.
Okay, what this also I feel, I've been in sports also. So whatever you do in life, it's all about muscle memory. You practice so much that your body knows your body systems comes immediately that, this is what I'm going to do at this moment. It should not be a thought which should be put. Right. When I say Virat Kohli hitting a beautiful six. It's years and years and hours of practice which actually made that possible.
Correct.
It's not something he decided just and then. This is a reflex which has happened. So that's how a doctor, I feel, we go to that zone where we know what to do. And once the things get rolling, then I would tell you from a point of view of a couple of my assistants. So when we operate, we are engrossed. We are doing the work, doing the job. It becomes very difficult for the people who are actually observing.
Okay.
Because they are looking, faces as such small, and you are doing something inside.
Yeah.
Now they are looking at us, and they're looking toward the
monitor,
watch, and everything. Yeah. Or exactly because they are not involved in that.
Yes.
But for us, the time we just started and then finished. But then within that 2 hours, 3 hours have gone. So that's the process the mind takes once you start doing the regular surgeries, and that is what has happened. Is like it should come like that. So basically, if you see, the challenge is to first thing for any such kind of situations is to be on board with the family, stabilize the chaos, be empathetic towards the people, and then if you have a set protocol, the SOPs are set. Things will fall into place.
Nice.
And yes, I'm a very big believer that there is a force which guides us. So not everything is on our hand. Even the force should also bless you.
Yeah.
There is always a requirement that you cannot think that I'm going to be the ultimate. There should be always a force which is there behind you, and the blessing should always be there. So yeah, and that way I feel really blessed that I could help the people here.
Yeah.
So yes.
So
that is the thing.
Nice. So you had mentioned that you have conducted around 175 plus cleft surgeries.
Yes.
So you often said also that you collaborate with different other doctors or specialists in this, like speech therapists.
Yes.
And what has these experiences taught you? Like, what do they mean to you personally, doctor? Because you're treating, like as you mentioned, you are treating children and you are very empathetic towards their situation because their speech and their other facial expressions can be questionable if things go wrong. So, personally, what does this mean to you?
Yeah, I'll tell you an example. Last week, last week we operated on a baby who was 6 months.
Oh, 6 months.
So
Right.
yeah, 6 months. So she had a lip, cleft lip, and the thing is that once we got the baby and like we're getting operating that. So after we finished, the mother came. She's hardly in her 20s, very young. Okay. Then the mother's father, his grandfather, his child's grandfather, he was there. And he was like, good, now my daughter can go back to her in-laws.
Oh,
And I was like, I didn't understand. I was like, what exactly? No, the child was born with this, and they had told her to go back to our home. And I was like, it is not something very a big issue, right?
yes.
So we are dealing, we are trying. But then once I might tell that, but then in my mind, I know that we are fighting, say, the knowledge of the people is so limited. The fight is not on the operation table. The fight is actually putting the word out that, these things are not something untreatable. These can be treated as such, 3 months, 6 months, you can treat it.
Yeah.
And it will be like, they never had it. So I felt like, there is this lady, 20 years old. She is a mom now. And I was thinking at 20 what I was doing. I was in a college and didn't have. She's handling a family. And now comes the trauma where she's been for the father. And he was like telling that this is really great that this operation is done for free. I didn't have to spend because we have seen these cleft cases.
Yeah.
They come from this lower strata like income groups. It is really difficult for them to spend that much money.
Yeah.
Yes. Yeah. So very difficult. So there are two things. One, that maybe, once I was working out, after finishing everything, I was walking out, I was talking to my assistant. I was like, we should put the word out more. The word should be more. Tell them that, if they see anyone like this, they should send.
Yes.
And tell them it's free.
Free of cost.
Yeah. So operating is a challenge that is in our hand, but this disinformation, the lack of information which is there, because all this, we share a border with Bangladesh.
Yep.
And there are a lot of areas where we see a lower strata income group, malnutrition during pregnancies. So these things keep happening here. And I would say in that, I would say BSF, once we did with BSF, and BSF has their wives, BSF Wives Association, BAWA. So they had taken a huge thing of, identifying these patients in the border areas. So they give the vehicle, they bring them here, and even the doctors, the government doctors who are posted in the areas where very very small PHCs are there, primary health centers. They identify even we have this ASHA nurses who go to this home. They identify So slowly that system is coming.
Okay.
People are going there and knowing it. That what exactly is the thing, and it is done like the word is spreading.
Nice.
So, but then, it is a challenge. The challenge is that way that you spread the word, and even we do some plans where we do social media campaigns. But then, if you see these kind of places, they don't even have the mobile where they can access this kind of information.
Yeah.
So, going to the grassroots, training those nurses to talk to the people.
Beautiful.
That becomes really important.
Very beautiful. Very nice. Really wonderful work you're doing there, Doctor. I must say that. Apart
Thank
from
you.
these surgeries and clinical practices, you're also deeply rooted in the teaching part, right? What do you like more, teaching or surgery?
It's a very tough decision to make. It's like, Yeah, I what I do, I try to teach through my practical this thing more.
Okay.
I like my doctors who are there with me, them to be with me, practically talking, seeing what exactly is happening. So I love to do that.
Great.
And as I told at the very beginning of the show, that my teacher told me, don't let your knowledge flow. The knowledge flows, it will end up somewhere, and I always took his word, Dr. Bala. He used to tell me that, like, he's a big fan of Rajnikant and he would put songs and, yeah, I learned this from him. He would put songs in the operation theater and operate. So first time when I came here and I put the song, the sisters, the OT sisters looking at me and I was like, no, it keeps me calm. I worked in that.
Yeah.
So he told me that, always let the knowledge flow. Whatever you learn, the smallest thing, smallest bit, whatever you learned, you give it to the other person. So maybe this will keep flowing as such. And like a country like our country, we really need, because there are a lot of doctors who are there, very talented doctors. Maybe because of something, they are stuck. And they want to go out and learn. But then if you become that much that, you teach them that very basic things.
Yeah.
What I believe that it's medical science. Yes, you can have the big degrees and everything, but when it comes, if you have the patience, when you deal with real patients, real scenarios, when you do with them, because it is very different in the books. Very different in the books. The books have been written in a particular way, but say you take a nerve. The book could just draw this nerve will like this.
Yeah.
But when you come to practicals, the nerve is never in that line. It is everywhere else but there. So I believe in practical thing, like, giving, there is no, for me, there is no, like, you cannot do it. There is always, you can do it.
Anything can happen. Yeah. Anything.
Yeah, you can do it. And you can do better. It is not like that you cannot do. You do, and you can do better than that.
Got
so
it.
every day, it's a challenge for ourselves to do better than what we did yesterday.
Got
So that is what I feel is the thing,
Got
rather than challenging. Looking, I keep on telling my other doctors also. Okay, see, the thing is that Northeast as such, the doctors are now there are a lot of doctors coming. So they think we have this buzz discussion. A lot of doctors are coming. This coming. But stop looking at them. You look at yourself. What you did yesterday, do better than that. That's how you live. Because otherwise, see, we all deal with a lot of stress. Especially I will not say, even I will not single our surgery. As such, doctors deal with a lot of stress.
True.
And the expectations are so high. So because I really people when they tell no, doctors are like they're like God. They come. It is not like that. Doctors are humans. They cannot be. Yeah, they are means through whom they are the humans who are chosen, through whom the God is actually giving you that avenue.
Yeah.
That that life is life is good.
Yeah.
You can. I don't believe that you can be a God. You cannot match that. But there's a means through which it happens. So so coming back to this, we all have to keep ourselves as that vessel that we provide. Keep ourselves updated. Try to whatever we learn. And big thing is that as you said, I would say I learn a lot from the young ones. A lot of things, because nowadays these guys are really smart. Really smart. They are very good with their electronic devices. If you want to see an article, immediately they will find.
Yeah.
Before I don't know. I really don't know if they really go physically to library now, because the whole thing is in their system.
Yes.
They have a system. Everything is there, and they are very smart. So I really follow them, and they have so many things. Like before, we used to rush to the library, find the books where it will be.
Yeah.
And now with the internet, these guys have everything in the fingertips. They just, sir, this is the article which you wanted. And I was like, okay, fine, great. That's great.
Yeah.
So it's all about learning from them also.
True.
It's not that I'm only sharing my knowledge, but whatever they bring to the table, it's like, it's great. So it's a mutual thing, and as long as this is a mutual thing, the team is supposed to come up, successful. That's what I believe.
Very true, very true. That it's always a mutual thing. All right, Doctor, you have also received a lot of awards and have been presented with extreme great honorees, right? So, today, looking back, you have been an entrepreneur, you have been a surgeon, you have been a teacher or a mentor. What does success actually mean to you?
Success, as I said, it is for me. I would want to do better than what I did yesterday.
Okay.
It's like that for me. So I when I get up in the morning and I say, yesterday I did a very good case, and then I would try to see. We take these pictures and we go see, and then we'll this is not this particular thing would have done better. So now, before success was like when I joined, I became a consultant. Becoming a consultant in a big hospital is a success for me. Or getting that award is a success for me. But now it is like I can do better than this. What I've done, I can do better than this.
So you're
That is a success.
competing with yourself each day.
Yes, I would say that because you set a benchmark for yourself and you do this. Say, I would say when I start the day, the first patient with whom I say consult, what kind of behavior, what kind of smile, what kind of the talks, the explanations they get. I'm not going to the end procedure. I'm just talking about the counseling. I want the last patient to receive the same kind of thing. The last patient of the day should also have. Yeah. So he should not be thinking that, just because I came, he didn't speak much with me. So I want to build that, I spoke to everyone properly. And they are like, I could make them understand. Because what happens is, another thing which I would like to revisit is, because the information, there are a lot of things which keep on happening in the world in medical science.
Yeah.
So not everyone of our patients, they know this happens.
Yes.
So if say this patient walks to me and I tell him that this is the process, maybe he will do it. Say he will do it under me. Maybe he will not. Can have a lot of reasons, but that knowledge should not be kept. Should be given so that when he next time walks into another clinic, he knows this process is possible.
Yeah.
Right.
Yeah.
So that's what is the I'd say the very initial challenge, and that is if I have spoken to all the patients, I make them understand. I keep them asking, "Did you understand?" Because another thing which my professors tell, as a surgeon, you have to actually show, as a doctor itself, you have to show the result before the surgery to the patient through your words.
Yes.
You have to do it through your words. This is what say we do this surgeries called orthognathic surgeries where the jaws are bigger. We tend to set them back smaller, make the face look beautiful. So I have to make sure through my words that this is how you're going to look after the surgery. Because now although there are a lot of softwares have come, but we don't have those softwares here. So still it is the word of the mouth that this is how you look after the surgery. And it has to be said. You cannot be telling that this is 100%, you end up in 50%. You say 100%, you have to be at least 85, 90%. Because say 5-10% they might, fine, they went for a surgery, So that is success. And end of the day, when a patient family talks to me, that they are finally relieved that this has happened. Because leave the surgeries which you do, even for a small tooth extraction, I have seen parents being very worried for the children. Or the children have this thing. So it is a surgery or a small tooth extraction. You have to be very empathetic to the people and tell them. You have to make sure they are comfortable. So this is again, end of the day, when they tell thank you to you, a small thank you to you, that is also a success for me because it's like, whatever I've learned, what I've done, it has come here to the fact, this person is smiling. Right. So it's really important to me that way. Success, it changed in due course for me. That's what I'd say.
Nice. That's very interesting that you see that patients, caregivers are happy, and that is kind of success for you today,
Yes,
apart from
of course,
competing
of course.
diseases. That's nice. So, how do you see that this field is evolving in the next 5 to 10 years?
A lot is happening actually. Robotic surgeries are happening. Lasers have come. Now, like, and with all the diagnostics and everything which have been given. As I said, before here, and not before, like here in my state, I have to make someone understand through my voice. But my friends there in Chennai, Bangalore, they have got this 3D models printed. They will show that, this is how the surgeries are going to.
Yes.
So it's moving very fast now. So, and like, a blink of an eye, and if you say, if I say dental implants, we started doing it once I was here, and implants we did in our studies in 2009, whereas here I started doing in 2014.
Okay.
Okay, so first thing, the first challenge, although implants were discovered much earlier, much earlier than that. So when I told them that there will be a titanium screw which will be put inside the bone, now half of the people are like, "You're going to put a screw inside of bone." And what if this gets rusted? So that's where we start, like here, like, okay, rusting. So, sir, this is titanium. This one is going to be inside your bone. It's not going to fine. Then comes the question, if there is an MRI, what happens? This will come out. This is metal. No, this is not reactive. This is so that's where. And I feel these are also small developments which I would take. Yeah, it is not that medical science has gone very far, and these are also informations that you pass, and they get the knowledge, and they're like, okay, great. So you can put this screw inside, and it will stay there.
Yeah.
And it will stay for the lifetime. I said, yes, it will stay for the lifetime even after you, because you cannot burn it.
Yes.
Well, okay, great. So then certain patients keep telling, is this possible in this age? So I said that, see, this teeth is supposed to serve you. And at a particular age only you lose. So then only the replacements will come.
Yeah.
If you lose teeth in a very early age, then it's wrong. Something is wrong with it. So every day for us in here, in our state, is a development. But medical science, they have gone to a great level. They are trying intrauterine correction of the clefts also.
Okay.
Robotic surgeries for all the thing. Lasers have come. In our clinic, still we are using the blades, the knives.
Okay.
They're using bloodless ones, where even a few patients, they have done it there, and they come and ask us that you have these lasers, they do with the lasers, there's no bleeding.
Yeah.
And a lot of things. Even to be very honest, I'll go down to the level of a needle bore. The thickness of the needle also has gone so fine now.
Yes.
Because that is a scary thing when you take a needle out. And they've now got guns which are immediately injects. There's no needle involved. It injects. Then I'll tell you another simple: sutures, stitches. So people, you have done it very nice, and you take out the stitch, and they are like, "Oh my God, he's going to do suture now."
Yeah.
Now they've got the glues, beautiful glues. They have got.
Yeah.
They're using the glues. Yeah. So every day it's like, it is very much evolving.
Yeah.
And maybe like the real I will tell the real evolving would be if there is no more accidents on the road. But medical science, we all are prepared. Whatever the situation is to us, we are prepared, and every day it's a learning process.
Great, doctor. Before we go away from this podcast, one last message that you want to give to young doctors, especially those who want to create an impact in the field of yours.
Yeah, that I would tell is the thing that I will tell you from what I have learned being here in this state. There will be a lot of challenges which will be thrown to you as a doctor. Really, starting from the day, a challenge can be from the very basics of starting your car also. We are bound to keep our heads in the game.
Yeah. Yeah.
And I want all the young doctors to have nothing but empathy to start with the day. Should have empathy towards your patient.
Great.
That's the very basic block you should have. I'm not going to that you should learn this, learn that. Learn the very basic of empathy. The first thing you see a doctor, they actually are seeing that, he's the person who is going to clear our doubts, treat the person who is ailing in my family, is my blood king, and I just expect him to be clear with me.
Give a clear
Nowadays,
communication about it.
Yes, it should be clear, because once you have a clear message being put to a family and you are empathetic towards that family, your job is half done. The patient, when he feels, nowadays they're doing a lot of research and they're telling that psychological things matters a lot in healing.
Yep.
So a patient, once he thinks that I can be good, if you instill that thought inside him, that you're going to heal, don't worry, because the body has the powers to heal.
True.
We are now using a lot of plates and everything, but then in the other ages, the body used to heal. Whatever happened, they never had such kind of surgeries and all that.
Yep.
So I would say start the day with empathy. There should be every patient, as I said, they come with the chaos. We are supposed to, even I would like to put another thing, what I always talk, in this curriculums, on this, our dentistry curriculum, they should have a clear-cut thing where they tell us how to deal with the stress.
Yeah.
They should induct this stress relieving protocols. How do you do it? Or maybe a counseling sort of, because doctors as such go through a lot of stress, a lot of hard work hours, and this affects, maybe say a patient gets 5 minutes late to be attended. Now, those 5 minutes mean a lot to the patient family and the patient. So if you train the doctors, BDS is a very beautiful curriculum, Masters is MDS is a very beautiful, you should induce such kind of sessions where you deal with the stress, because no one talks about it for the doctors. The stress they are going through.
Yeah.
It is, I would say, because I have to, as I shared with you, it started with a small needle prick. So now we're doing big surgeries, big shots. We tell that the big boy is running, but then the reality was that I was scared to put one prick into a person. So it's not that the doctors who successfully operate, they don't go. They have their own stress, their everything.
Yeah.
So yes, first for the doctors, I would say that be empathetic towards your patients and try to understand the chaos inside them. Settle it, then go for your job. You will be definitely having less stress going into it, and you will succeed for sure.
Awesome.
So obstacles are going to come to you. It's not always. There are a lot of things life teaches us through a lot of obstacles.
Yeah.
And this also I tell that this obstacle has come to your life because maybe that power thinks that you are able to take it. You are built to take this kind of a thing to face. So otherwise you won't have got. So that's what my thing. That don't lose heart. I've seen a lot of people tell that patients are not coming. Your day will come, man. You're supposed to just keep doing your best for a single patient who has come to your clinic. Be empathetic towards them. Give your best. Compete with yourself. And end of the day, it will be, look back and you will be like, okay, fine. I had this thought at that point of time. It's long gone.
Yeah.
So that's what I would say to the young guys.
Awesome. That's very interesting, Doctor. Being empathetic and giving them the kind of information they need, and that's very, very crucial in any of the doctor's journey. Thank you so much, Dr. Deep Dutta. Your journey is so powerful, where you integrated or incorporated all the systems that you learned in Chennai and Bangalore in Tripura, and the challenges that you face, the kind of information you're providing to all your patients, their caregivers, and you're also teaching. That's kind of amazing. Congratulations to you, Doctor, for all the awards and all the achievements that you have made. And I wish you have many more of it. And that's great. Thank you so much, Doctor, for being here.
Thank you for the platform. It was great talking to you.
Same here.
And be here on the platform. And I really loved it, sharing everything.
Yeah.
So maybe somewhere, someone listens to it.
Yeah.
There's a doctor, maybe somewhere here, they thought that maybe we should move to a bigger city. But good days are coming.
Yes.
Just be hold your ground and, be for the people who are there.
Wow.
So thanks a lot for the platform. It was lovely talking to you.
Same here. Thank you so much. And it was great talking to you too. Awesome.
Thank you.
Good day, doctor. Good.